Thanks, Mindy. So I have the honor of introducing Dr. Barry Singer, who's the keynote speaker. For those who don't know, he's truly a thought leader in the world of MS. So it's really a pleasure that he's agreed to be part of this program today. And if you haven't gone to his MS Living Well podcast, I encourage you to do so. It's really a great source for relevant and up-to-date information on MS. But as far as the formal introduction, so Dr. Barry Singer is the director and founder of the MS Center for Innovations in Care at Missouri Baptist Medical Center in St. Louis. He is an associate professor of clinical neurology at Washington University School of Medicine. He has been an investigator in greater than 35 multiple sclerosis trials focused on new therapeutic options, including remyelination. He attended Duke for college and Columbia University for medical school, followed by residency training at Cornell and a neuroimmunology fellowship at the National Institutes of Health. He serves as on the board of directors of the Multiple Sclerosis Association of America since February of 2016 and has a position on their executive committee. His award-winning MS patient education website, www.mslivingwell.com, started in 2007 and has been a truly valuable resource in 200 countries. Dr. Singer is also the host of the MS Living Well podcast. So without further ado, I welcome Dr. Barry Singer.
All right, thanks, Dr. Belkin. Thanks so much. Thanks, Mindy. Good to see Dr. Bieber there. And I'm excited to be talking about kind of taking what Dr. Bieber was talking about and taking a different angle at it. So we're going to talk about thriving with multiple sclerosis. And, if you're newly diagnosed out there, this is a, curveball with this diagnosis. Life is cruising along and then all of a sudden someone slaps his diagnosis on you. And how do you cope and where do you go? And then those of you that have been living with it, I have patients who have been living with MS for over 30 years. And how do you keep going? And how do we improve your quality of life? I mean, as an MS neurologist, I've been doing this for over 25 years. It's really about what can I do to help you in the clinic. And then this talk is really about what you can do to try to help yourself. And I think that's really the key goal, is so that you can live as well as you can with this disease. So we're going to dive on in here. Let's see if I can advance the slides here. Let me see. One quick second, I got a request remote control. There we go. There we go. Okay, so I want to really talk about a couple main topics. One of them is fatigue. So 90% of people living with multiple sclerosis have significant fatigue. And this is probably the biggest issue that we see in the world of MS. And the question is, what can we do about it? What causes it? How we can change the future? And so when we think about fatigue, there's really two types of fatigue that people struggle with. The overwhelming one is feeling tired, like you didn't get enough sleep. So you slept all night. I have patients that had a good night's sleep, wake up in the morning, and they get a shower and get dressed, and they have to go lay down again. They're just worn out. Or in the afternoon, or they go work all day, and then they come home and they have to go to bed at like 7 o'clock at night, not be around their family and take care, be able to be with their family in the evening. They have to go to sleep and sleep 10 hours. And so this overwhelming fatigue can be very difficult and very challenging. Many people, the family doesn't really understand. Friends don't understand when you have to cancel out, tap out, because you just don't have that energy. And so 90% of people really struggle with this. And the other type is physical fatigue. So I have some patients that are alert all day, but because their legs get so tired because of the leg weakness, they have this motor fatigue is what we call it. So this physical fatigue, they just can't, because they're weak and it requires so much more energy to do the same thing, they're physically weak, but they don't feel tired like they have to take a nap. So why do people with MS get fatigue? So it's interesting. We're now looking at some new techniques of imaging the brain and trying to understand this. And one of the things that we see in the brain There's pathways. And for example, on the left, you can see the area called the gray matter, GM, gray matter, and there's a green track. And this is actually reproduced using a type of MRI called a functional MRI. And we can see how the brain functions while using this MRI technique and see what areas get activated using a certain task. What you can see is normally one part of the brain sends a signal to the other part of the body. And so your brain communicates with different sections of the brain. And so the green track is intact. Now, what you can see on the right is a white matter abnormality, the WM abnormality. So when you have with MS, you're going to have plaques, these MS plaques or lesions that disrupt that pathway. And so let's say your brain, you want to move your leg and you have this pathway that's going to go through the brain, communicating from the gray matter, from the cortex, down into the white matter to move your leg. And if you have a lesion there and it's disrupted, what happens is that your brain has to compensate. So what it does is it creates new pathways around the obstacle. So you basically, it's like a roadblock. And so the communication is blocked, it has to find new ways to go. What we find in people with MS that have a lot of cognitive impairment is there's much more activation of the brain. So there's all these other pathways to get around the roundabouts, to get around these obstacles. And that can cause cognitive fatigue. So your brain has got to work that much harder in order to accomplish the same task. So it's less efficient. Another cause for fatigue in MS are chemicals. And our immune cells talk to each other. And they talk to each other with an immune chemical called cytokines. And so cytokines are these chemicals that one cell, like a T cell, will secrete or a B cell will secrete these chemicals. And so they're basically a protein immune communication technique. And so one study was 35 patients in the Netherlands showed that this one type of cytokine called interleukin 6 or IL-6 was higher levels was associated with severe fatigue. So those people in their blood had high levels of this IL-6, had increased fatigue. We also know another study that was done in Brazil with 30 MS patients, looked at the same blood IL-6 and was also high in patients with high fatigue. And then also another one called tumor necrosis factor alpha or TNF alpha. So these cytokines were upregulated. And the one way you can think about it is we also, let's say you get a viral infection. So the virus is in you, hopefully not COVID, but a viral infection. And as a result, your immune system gets ramped up because it's going to fight that virus. Well, you feel really tired when you get a virus. And that's because of these cytokines or trying to fight the infection. So it's one other way that we may be more tired from if you have MS. Now, how do you improve fatigue? How do you reduce it? One of the most important things is to fix poor sleep. So I see this over and over again. You know, people come in, oh, I'm exhausted. Well, why are you exhausted? Do you sleep well? Well, no. So we really have to look at sleep. Many people can't turn it off. You know, you're like, end of the day, you're just in bed and you have to solve the world's problems. You have to solve your children's problems, your parents' problems, your neighbors' problems, you know, and you just can't, you're still running through conversations with your boss in your head and you can't shut it off. So find ways to kind of relax, turn off the cable news at night, turn off the, avoid caffeine, probably don't drink a lot of water just before you go to bed. Maybe some relaxation music. And if it's not working and nothing's responding, you could definitely talk to your doc. We use frequently over-the-counter medications like melatonin or Benadryl, sometimes first, and then sometimes prescription medications. Sleep apnea is very, very common. Tends to be, can happen in anyone, but it tends to people that are overweight. And this is snoring at night. So you may be snoring, stop breathing. And in the morning, you can feel exhausted. And, you know, many of my patients who have been diagnosed and started on CPAP or BiPAP, these, a lot of people do a lot better. They're much more alert, much more awake, and it may not be the MS. Restless leg syndrome. So people get restless legs in the evening. They can't start got to get up, got to walk around, your legs are fidgeting. This is different from cramping or spasms that can happen with MS, but restless legs is very common, sometimes runs in family, sometimes due to iron deficiency. And so if you have restless legs during the night, which we call periodic limb movements of sleep, those things can keep you up. Many patients with MS have cramps at night. So their legs will spasm, legs will cramp. May not be so bad during the day. Some people, it's during the day and at night. And so we definitely look at muscle relaxants to try to control that. So a little bit of muscle relaxant at bedtime might help you sleep a lot better, reduce your daytime fatigue. And then we have to fix bladder issues. I've got patients that come in, they're 6 or 7 times at night, they're going to the bathroom. Some people just go 2 or 3 times a night, but then they're up for 2 hours. They can't fall back asleep. And so we really have to work on the bladder issues. So that's really important. So we've got to focus on your sleep. If you're sleeping well, then we have some other options. So then what else do we look at? I think one of the most important strategies is what we call energy conservation. And so energy conservation means you want to rest midday. You do your physical activity in the morning, have some time, 2-3 hours in midday to rest. Let's say you're going to go when you're on a trip, you're going to do a little bit of maybe going out, kind of physical morning and rest midday, and then do something lighter in the afternoon. And so I think it's trying to figure that out. Exercise does reduce fatigue, so it is important that you do that regular exercise. So whether it be yoga, swimming, recumbent bike, but exercise has been shown over and over in clinical trial to actually reduce fatigue. Some of my patients say, "Doc, I'm so tired, like how am I going to exercise?" Well, best to do it in the morning. I think that's when you're going to get the best time to do that, and you start slow and build. I think it's also important to plan ahead. So if you are, if you're going to go out and about and you got a lot of fatigue, have the right mobility device for the right situation. If you're going to go to a big box store and they got a cart, great, that might be the way to go. But if you're going to go on a longer distance or you're on a trip, then maybe get a scooter available. Some people go out of town, you can have a scooter waiting for you at a hotel. So think about the right equipment for the right situation so you don't waste unnecessary energy with the transportation. You want to enjoy your time when you get to wherever the location is. Cooling vest. As Dr. Belka mentioned, I'm on the board of directors of the MSAA. The MSAA provides free cooling vests for people that qualify. Just go online. It can make a huge difference. Come August, I'm out here in Missouri. It gets hot. And if it gets hot, people start to melt and they have no energy. So we do that. And then avoiding heat, don't go out and mow the lawn in the middle of the day. Try doing it early morning when it's not as hot out, because obviously that's going to ramp up fatigue. And then really it's about educating the family. So, what does fatigue mean? Educating your friends. It's an invisible symptom of MS. So people don't understand and don't really get it. And so the more education resources the family has and friends have, the more supportive they can be. Now, one of the interesting therapies that can be very effective and has been shown over and over recently in a few trials in MS is cognitive behavioral therapy. Actually, unfortunately, Aaron Beck, who founded cognitive behavioral therapy, just passed away, but at the ripe old age of 100. And so he founded this. And this is a study of 91 MS patients who were treated over 16 weeks. And in this, using cognitive behavioral therapy consisted of 12 individual sessions with a psychologist trained in CBT, or control treatment, which consisted of 3 consultations with an MS nurse. So you either got the psychologically trained CBT or you had an MS nurse meet with you 3 times. And so they went through different modules depending on your specific needs. They would look at formulating goals for dealing with fatigue, regulating sleep-wake patterns, changing beliefs regarding MS, changing your beliefs regarding fatigue, reduce the focus on fatigue, regulation of physical activity, social activity, mental activity, addressing the role of environment, handling pain. So these different modules were done, and severe fatigue was reduced significantly in these patients on CBT treated patients versus the ones that just met with the nurse. So this has been shown in different trials to show positive benefits. So this may be something to incorporate, which does not require any medications, just some specific training to reshape your ability to cope with the with fatigue. Now, when that doesn't work, we do have prescription medications. Now, none of these medications have been FDA approved for the treatment specifically for MS fatigue. And so we use these off-label, but we use them frequently. And so these medications include modafinil and armodafinil. Some of you may be familiar with Provigil and Nuvigil, which help with wakefulness and have impacts on a deep part of the brain called the hypothalamus. And it keeps people more alert and more awake. Amantadine is an old medication that's been around for a long time that has antiviral properties, actually also used in Parkinson's. Sometimes effective. I give it about a 50-50 shot, but it is more gentle. Some people, the other drugs are too stimulating. And then frequently use amphetamines. So this includes drugs like Ritalin, Adderall. Sometimes those make a big difference. There was interestingly a trial that was done not too long ago, pretty recently, that looked at putting people on placebo, modafinil, amantadine, and an amphetamine. And they rotated, and everybody did all four and were blinded, and they didn't show a difference. However, most of us doing MS and treating MS docs, treating people with MS, show a significant improvement with these medications for many of our patients. So it makes a big difference. So this is a way to go if the other methods don't work, or in complement with the other methods. So my other topic I want to talk about has a lot to do with kind of what Dr. Bieber was talking about, mental wellness. And so now this is definitely a comprehensive approach to looking at your overall mental wellness, and not just mental health, but just mental wellness in general. So one of those aspects of mental wellness is your cognition. And unfortunately, we know about half of people with MS have some cognitive issues. And the most common problems is your ability to process things quickly. So the speed at which information is processed, partly because of those disrupted pathways that I mentioned. And memory is definitely another issue. So we definitely see it's called episodic memory, short-term memory seems to be affected in people with multiple sclerosis. Many of my patients report problems with word-finding difficulties, multitasking problems, but unfortunately, there's not a lot of research there. There was a study done out of Mount Sinai that people with word-finding difficulties had some thinning on the left side of the back of the brain called the parietal lobe on the gray matter. But this is a big issue for many of my patients. And we definitely see cognitive problems can happen early in relapsing MS, but much more common in patients with progressive disease, whether it be secondary progressive or relapsing disease. I mean, more common in progressive disease, whether it be secondary progressive or primary progressive MS. So we do have a lot of strategies to improve cognition. And these include definitely effective disease modifying therapy. So I think that's really one of our key goals, which can definitely help with cognition. We've seen clinical trial data that helps with that information processing speed, that it's better on drug than off a drug. And in addition, we want to improve cognition. Exercise has been shown to be useful. We want to be able to prioritize tasks. You can't be multitasking. It's just sometimes much more challenging. So figure out what's important and really focus on that. I find removing distractions in the workplace is great way to help cope. So maybe sometimes we even write workplace accommodations so someone's workstation can be not in the center of an office. Exercise is going to help. Vitamin D has been shown to be beneficial on cognition. And smoking has definitely been shown to cause much more cognitive impairment. Some interesting data that just came out of the UK registry show that if you discontinue smoking, you can actually improve your prevent further disability. So it can really change their disease course by stop smoking. Good sleep is important. Everyone knows if you don't get a good night's sleep, you're not going to be focused as well. You're going to have more word finding difficulties. And we definitely want to treat depression, which is not going to help you focus. Trouble in addressing fatigue. Stress reduction can help. I mean, your concentration is not going to be good if you're under severe stress. And speech therapy can really help. And so sometimes we'll do formal neuropsychological testing, figure out where the issues are, and then have targeted speech therapy to help improve and compensate for those issues. So one of the things that we want to focus on is also improving mental health. And clearly, it's been a struggle with the pandemic. And we know that depression and anxiety are very common. I have a study here from Canada. It was in 1,922 MS patients. And really, over the course of the lifetime of someone living with MS, depression was found in about 45% of patients, and then 49% had anxiety. I think anxiety in MS is really understudied. But these are huge issues for people living with MS. And so why do people with MS have depression and anxiety? Part of it is having a brain disease. Many of our neurologic diseases, whether it be Parkinson's, stroke, are definitely associated with depression. And so structural change in the brain may put someone more vulnerable for depression. And then immune changes. So again, these cytokines may be playing a role in causing depression. Many people, when they get diagnosed with MS, it's a kind of reaction to the disease and just coping. That first year, we heard from Dr. Bieber, the patient that just got diagnosed. And so having the reaction to the disease is sometimes overwhelming and can lead to depression. And then obviously reaction to disability. It's very hard. I have a lot of people who love their job, love teaching, and because of disability, they can't do that. And it's going to be very hard adjustment. And so depression can sometimes creep in there. And then medication side effects. One of the side effects of interferon can be depression. So we have to be aware of that and cognizant of that when we're making treatment decisions or even considering treatment switches. And so the treatment is going to be a combination of options. One would be therapy, meeting with a psychologist, a therapist, psychiatrist. The psychiatrist would prescribe medications. So you could either meet for a therapist. It could be like someone with a psychology PhD, PsyD, or someone with a social worker. And then other people, counselors, like they have clergy that they like to go to, or have some other counselor, someone to talk to. And sometimes it just helps to have a neutral party. Now there's even online support, and many of these are covered by insurance, different types of therapy. So one of the other approaches for good mental wellness is mindfulness. And so mindfulness is a type of meditation, and you can just go online. There's videos to do it. And so benefits in people with MS have been proven in a number of different clinical trials. And so this type of therapy about learning, getting more in touch with your body and being in the present moment, not thinking about the future, all the things you need to do, and not thinking about the past and all the guilt behind you, but being really in the present moment. And this has been shown to reduce anxiety and depression in people with MS in clinical trials. It's also been shown to reduce stress, take the stress down by practicing mindfulness, and also improves cognitive processing speed, which is really exciting to see that it changes things in the brain. Maybe just taking a step back helps your brain start to process better. So all this has been proven in different clinical trials. So mindfulness is a great strategy. You may want to write that one down if you haven't done that as something going forward. Spiritual health. And so one of the other things that is important to think about is your spiritual well-being. It is one of those hallmarks of wellness that we look at, one of the dimensions that's really important. And everyone's different, everyone's got different religious beliefs and backgrounds. And some people, it's It's just being tied to a higher power, but not necessarily even, most people it's God, but other people it would be different, whether it's you're tied to nature. But really is that satisfaction of communication with a higher power, that you have that relationship. And then there's this, so that's your spiritual health is to a higher power. And then there's also existential health. And Dr. Bieber mentioned some of this about understanding the meaning and purpose of life. What is the purpose of my life? Why is my life meaningful? And so that's your existential health. And these are important parameters to help guide you through life and give you some positivity as you move forward in life. So spiritual health has actually been studied in multiple sclerosis, and there's some trials out there looking at having spiritual health and how does that impact someone living with MS. And they looked at, one study was looking in the Czech Republic, and they looked at 153 people with multiple sclerosis living with MS. And they saw the global quality of life correlated with spiritual functioning. So the more, if you had regular spiritual, you were a spiritual person and that you were engaged in a spiritual life, that your quality of life went up. And then interestingly, there's a number of studies that have been done in Iran on this topic. And one study of 210 patients did show that correlation with spiritual and existential health improved self-esteem of those living with MS. So it's another positive benefit of having that spiritual wellness in your life. There was another look at spiritual health involved this study of 213 MS patients in Germany. And so they looked at both the benefits of spirituality as well as religiosity in people living with MS. And a lot of what their views of these MS patients were saying is that people living with MS was really their spiritual health was kind of their stronghold in difficult times. So when things were getting rough, whether it be relapse, worsening disability, they really had that sense of support behind them. It was kind of a stronghold for them. They also interpreted their illness differently and in a positive way. Those that had more spirituality in their life, their illness had more meaning to them. Why do I have multiple sclerosis? Where do I go from there? And so it helps you reflect, the people with more religious beliefs reflect on what is essential in life, what's important. And they looked at the disease as a chance for development, that this is not a roadblock, a dead end. This is an opportunity to move forward in life. There's some reason why I have this, and I can do something positive about it. And really appreciation for life despite illness. So those are some of the benefits of spirituality and religiosity. There was also stronger feelings of gratitude and awe and the beauty of life despite having illness. And so spiritual health really can change your attitude and approach to coping with the disease, an ability to face life as it is. So I think it does kind of provide for a lot of my patients as well, kind of a bedrock in terms of being able in the foundation to move forward. And so, some people, it's not their thing, spirituality may not be the way they want to go. But I think some kind of connection is important to look at the disease and how you can move past the disease. So it's been a trying time for all of you. Many of you isolated at home, away from family and friends. And it's been tough. I've been hearing about it, it's almost a year and a half plus. And we know mentally this has been very challenging for people with MS. That sense of isolation, anxiety of being infected. Many of my patients are immunosuppressed and worried, and like many of you, like, am I going to get infected? How am I going to cope? Is my immune system competent? And so this kind of anxiety and isolation has been really tough. I think physically I've seen a toll. Some of my patients definitely haven't been in the gym in 2 years, kind of like this guy, and don't want to spread it to my patients. And that's hard because, a lot of people had aqua therapy going, some are going back to the gym now after 3 vaccines, but A lot of my patients have not been going to the gym regularly, not getting the exercise, which also helps their fatigue and their mood, not going to trainers. And so it's been really rough physically. And then, and a lot of my patients weren't going very many places, so they weren't walking much. And now I'm starting to see it. Now they're starting to walk more and they're starting to get out and starting to move about. And I find that some people have progressed during that period of time. So again, physically, it's been had an impact. And then medically, I think it's been hard. I mean, I see lots of patients who have not, seen them first time in 2 years. So I think you miss some with a virtual appointment. I can't see if your legs are getting weaker. And it's still a little harder without having full exam, full access to an MS center. And so tests tests have been delayed, procedures have been delayed. I have patients that haven't seen an eye doctor in 2 years. And so all these things have impacted wellness. So emerging from the pandemic is a time for renewal. Hopefully we're going to get there another 6 months. We got some positive data, just some data came in yesterday about a new pill that can reduce the risk of hospitalization, severe COVID by 89%. So it's an oral medication that can help if you get infected with COVID. So hopefully the therapeutics are going to continue to improve and more of the world will be vaccinated and we'll emerge from this pandemic renewed. And so when you go forward and thinking about the world again, when we can engage and communicate and socialize, where do you want to be? So you want to think about that healthy diet, get that exercise plan together, get your yoga plan together, work on that stress reduction, improve your social connections, reach out to people. So once things open up, you have those sustained relationships. Volunteer. That always makes people feel good when you're helping someone else, not thinking about your own issues, but thinking about how you can help other people. Look for spiritual guidance if you've stepped away from that for a while. Pursue your hobbies, your passions, whether it be gardening or painting. And now it's time, it may be soon, hopefully time to travel. So you may start wanting to work on that, on those plans over the next coming in 2022. So all exciting things as we move forward. So at this point, I would be happy to open it up for questions with Dr. Bieber. Just a little quick plug. I'm the host of the MS Living Well podcast. I have lots of experts on that I interview around the globe, including some patient advocates. And some of them include Mitzi Williams and Dr. Bieber were two of my guests. So please check us out. And there's a QR code on there to get right to the podcast.